So I'm joined by two, I won't say brilliant, they've asked me not to drop the B, brilliant word.
Which you just did.
But I did, I said it, I'm going with it and I'm sticking with it. So I'm joined by two, I think, really great panelists that I think are gonna offer some interesting perspectives on how we can take from the broader literature around navigation services generally and see what lessons we can pull forward to inform our work as digital navigators or organizations supporting digital navigators. So today I'm joined by Jessica Dine from the ITIF and also Michele Thornton from Oswego State University of New York. I had to ask how to pronounce Oswego, so I feel like I'm on solid ground. I am Allison, and I lead digital equity research for Comcast here in our DC office. And so what I'm gonna ask our panelists to do, and what I'm gonna kick us off with, is explain just a little bit about the perspective that they're bringing to the conversation today, as again, we continue to talk about what the evidence tells us on navigation services more broadly. So Comcast partnered with the Boston Consulting Group last year to conduct a research study on digital navigators broadly to help us define what does the space look like, who is participating in this, and what do we think the impacts of digital navigators are. And it was an incredibly interesting project and one that I was very happy to collaborate on. And one of the things we found is that digital navigators exist in all types of organizations, and they take on so many different forms. And there are people who have been digital navigators for 10 years, even though the term has only existed maybe for a few. And so I think many of you in this room probably have been engaged in digital navigation work long before we called it that, but we were really trying to understand and develop a taxonomy of what do those organizations look like and how are they engaging with their communities. And in terms of effectiveness, we found that digital navigators were helping people get connected and get access to devices. We found that they were helping people get jobs, higher paying jobs, better jobs, promotions. And we found that they were helping people get more comfortable with digital skills, digital tasks, and just being online and being safe online. And so that's a study we're happy to share afterwards. I can talk about it ad nauseum. I've been doing it for a while now. But I just wanted you to understand the type of work that we at Comcast, but also Boston Consulting Group have been partnering on in the past year. And so with that, I'm going to hand it off to Michele to talk a little bit more about her work that she's bringing to the panel today.
Great, thanks, Kate. Good to meet everybody. It has been just a joy to be here today because I come from the healthcare space. And so to kind of spend some time listening and seeing where some alignment was has been really valuable as I thought about contextualizing my comments this afternoon. So I am a health disparities and policy researcher. I do my work, as was mentioned earlier, I'm a professor in a school of business, actually, in upstate New York in the SUNY system. And I bring to this conversation a little over a decade of experience of collecting data, analyzing, and evaluating the navigator programs that were associated with the Affordable Care Act, or Obamacare, as many people know it as, right? This was a very significantly grant-funded program that started in about 2012. And we were in the unique position in Illinois to be able to track that entire brand new workforce that was developed because of how the state chose to certify and train the navigators at that time. So we've been kind of taking a look at that program. It still persists today. The Biden administration has continued to invest in this. But essentially, kind of, my comments will be kind of shared with that lens in mind of what we can learn from gathering data, tracking programs like this as a way to sustain and persist and continue the investment in them.
Awesome. And Jessica, please share.
Hi, everyone. I'm Jessica Dine. I first want to say I'm incredibly excited to be here. Enhancing adoption and closing the digital divide is so absolutely critical, and it's just a really great thing that you're all doing and putting together this summit. So I'm coming from the Information Technology and Innovation Foundation. We're a DC think tank that focuses on technology and innovation policy. My area of focus is broadband policy, with particular emphasis on digital equity and inclusion and all of that. So this is kind of a perfect space for me to be in right now. I guess the lens I'm bringing here is, first of all, the broadband lens. So as we try to see the intersection between previous healthcare programs and current broadband navigator programs, that's the side that I'm coming from. I've also put some particular focus on the data that we have on the digital literacy and digital inclusion landscape side. So the data data that we have, what types of data we need, what we're missing, just sort of like looking at everything that's going on that side of it is where my emphasis has been.
Awesome, thank you both. I appreciate it. So as I referenced in the beginning, digital navigators is something that's existed, I think, in different forms for a while, but it's a newer term that I think people are using. So Michele, that first question is for you. So it feels a little bit like a new field, but probably also very similar to a lot of the healthcare navigation work that you're talking about. So could you share a little bit about what your research has found in this space, particularly around what has been effective or tried? Like what can we bring forward from that healthcare space?
Yeah, definitely. And I should note that the Affordable Care Act navigators were certainly not the first to use that term either. The idea of navigation, at least in the healthcare space, came out of patient navigation in like the late 80s. So we're talking decades ago. But it was coming from a space of trying to bridge the gap of disparities, trying to help people understand when policy innovations had become available. And so we look backwards to experiences with cancer navigation, people learning that they would have access to new treatments, to new types of surveillance tools or things that could help them to either improve their health or treat a really scary condition that they might have. And the fear that we talked about, the confusion, all of the messiness of the healthcare system lends itself, right, to having somebody that you trust in your community, somebody that can kind of help kind of clear away some of the noise and help you figure out exactly what you need to do to get access to the services or the programs or the care that you need in this case. So when the ACA was passed, that's what really the model was to build that on. And what programs across the country drew from is this idea of community health work, patients being out in the community. So even though the Affordable Care Act was trying to connect folks to health insurance as a new federal program, they really were thinking about these kinds of grassroots, boots on the ground efforts and trying to understand the mechanisms that work to spread the word about those policy changes. In our research, we were really fortunate because we were able to not just measure things, which I heard a lot of folks talking about, like percent uptake, like those enrolled, in the programs, but not just those end impacts, but to really document what was happening with the navigators themselves. And I think this part of the story, if I was going to leave anybody with anything, is making sure that you are tracking and understanding what the navigators are doing in the community. Because otherwise it's really easy to assign the improvements that have been made in access to the policy itself and not the hard work that's happening on the ground. Mm-hmm. So we found that tracking who the navigators were, where they were working, what kinds of outreach they were doing, of those outreach, what worked better, what didn't, all of those things were really what mattered in Illinois. And we saw great differences by zip code to zip code. As simple as knowing whether or not there was a navigator working in one zip code versus another allowed us to differentiate that policy impact. So we were able to really show, and while it may not sound huge, but if we're thinking about if 10% of the population in Illinois before the Affordable Care Act was uninsured, there was a big drop in that overall, but the communities that had navigators working in them saw a greater bump impact, and we could really document that at that granular level. We could then go further to say what those navigators were doing and how that made a difference as well. So the basic things that I've heard a lot of people talk about today are not necessarily revolutionary, but are the things that work. Knocking on doors, making sure you're working with partners in the community that already have those relationships developed. But tracking all of that is, I think, what really matters, and to make sure that it's clear, right, that that's what's making the difference, not just that a new law has been signed.
Super interesting. No, sorry, I can talk about this all day. But I'm aware that I have an audience, so I should, But that's that's a really interesting point. One that certainly came through, I think, some of the research we did around trust and other things, and providing that focusing or clarifying lens is incredibly important. And I do like anything that sounds like it might be close to quasi-experimental or random. So thank you for that. I appreciate it. Jessica, I wanted to ask a little bit more about your work or your research and your examination of what's happening under BEAD. So, states have been asked to create these plans. They're meant to close the digital adoption gap. And so I'm really curious what you found in this space through, I know you have a few examples to share with us, but what have you found in this space that states are planning to do? And just share a little bit more about the context and your reaction to that.
Of course, yeah. So let me first put out there that I think the most effective thing states can do at the outset when they're designing these plans, the BEAD 5-year plans and the digital equity plans, is really facilitated by the example applications that NTIA has put out there. It's sort of taking stock of the landscape and taking account of all of the data that's out there and figuring out what you need, what resources you're going to need, where the barriers are, and how you're going to try to solve them. So that's a very important approach, and most of the states that I've looked at are essentially following that approach, which is just a very good thing to see at the beginning. I guess the first thing I'd like to focus on regarding how states are approaching this is what they're doing regarding finding the data that they need. Because like healthcare and like a lot of these navigation services, closing the digital divide when you're looking at the adoption side is an inherently highly data-driven endeavor. You basically cannot do anything if you're trying to very specifically hone in on the problems if you don't know exactly where the problems are. And there are a few things that are kind of issues right here. We don't have a great set of federal data. We have some different fairly helpful data sets, but we really don't have one comprehensive data set that we can all go to. So states have been pretty much tasked with coming up with their own data on inclusion. The second thing to note here is that when you're looking at data on inclusion, it's a little more complex than looking at data on deployment, because deployment was fairly easy to map, like whether it's accurate or not, it's another question. But when you're mapping deployment, you can basically look at it as a binary. Is there a network here that meets certain standards or isn't there? And so it's very easy to collect that data and to depict it. Inclusion is a multifaceted field. It's the product of a lot of different factors. It's more of a gradient than a binary for a lot of reasons. It's just inherently much more complex to gather the data on and to map it out. So I've found it interesting to look at a few of the approaches that states are taking when they're trying to map out this adoption and inclusion landscape. Delaware, for example, I think has a very interesting approach. They are taking the traditional mapping approach, but what they're doing is overlaying deployment data with different indicators of social advantage or vulnerability, things like income, race, employment, education level, just all of these different factors that can play into inclusion, overlaying it over the deployment statistics. They're then overlaying that with the locations of community anchor institutions, which, as we know, also play a pivotal role in providing internet access and inclusion support to people who may not be digitally included right now. So by sort of like creating this holistic visual, a literal visual of the inclusion landscape, they're able to really easily assess all of the different factors that play into it, but also the relationships and the patterns between them. So I really like that approach. Louisiana's taken a similar approach, more in the yes, Louisiana is huge in the inclusion space.
They really are.
I know, I'm not totally, no, they're doing very well.
Yeah.
They are basically coming up with, they're just coming up with a website that's listing out like different deployment factors, access, adoption, just all of this. Any of the states that are approaching the data side by doing something that combines different factors, I think is really heartening to see. Another major source of data collection when we're looking at the actual collection has been surveys. And that's really helpful because it's getting the information directly from the people who are affected, and there's less potential for incorrect data or missing out on certain groups of people or any of that. So Hawaii, I think, is a great example of a really effective survey. This had actually been done a while ago in 2021, but the state of Hawaii put out a digital literacy survey where respondents were asked to sort of self-assess their level of comfort with digital skills and digital literacy. And that basically allowed the state's Department of Labor to lump respondents into 4 different categories. And in doing so, have sort of a broad idea of which group of respondents was at this level of digital literacy and would benefit, and digital inclusion, and would benefit from these types of interventions, or this level. So it just gave them a sort of broad idea of what their overall state was. That gave them data that was more granular if they wanted to look more deeply into it. So that is the mapping and data side. Now, if we're talking about the actual implementation, Obviously, in terms of implementation right now, we're not really there yet. States are currently in the planning process of, they're building their equity plans right now. So we haven't really seen a lot of implementation yet. There are a few examples that I'd like to highlight in a second. But having looked through some of the digital equity plans, I mean, again, I'm seeing really good things from most of them. For example, Maryland's, well, the first thing I noticed when I looked at Maryland's digital equity plan was that they have a very long appendix that lists out all of the different working groups and outreach programs they've conducted. And now part of this plan that's mandated is that states have to plan how they're going to conduct outreach with different stakeholders and write out what that outreach was and everything, but actually specifying who they spoke to is really helpful because then you can at a glance see, oh, they completely missed this group. Like this is not a group that's going to be represented in their plan. So it's helpful for them to already have taken stock of that. They also just generally in their implementation adhered pretty well to the general ideas that have been said a lot through the day. Like at the higher levels, the state's going to focus on allocating funds to the right locations, but they're going to make sure that they go to the localities who are going to be able to implement the specific programs that are necessary. They're putting a lot of emphasis, and this is a recurring theme in a lot of state plans that I've seen, a lot of emphasis on funding public libraries to try to create navigation programs from there and digital literacy programs from these libraries with the built-in trust. Louisiana, again, fantastic example. It's impossible not to bring them up. They're also doing that. They not only brought up digital navigation programs and are already planning how to do that, they're already thinking about the logistics and the organization of those programs. For example, they have one suite of digital navigator programs that will be sort of run through their libraries. And they're thinking about who's going to run that. It's going to be the state public library. They've got another suite that's going to be run through their post-secondary institutions, educational institutions, that they're putting together a board to direct that. They've got a separate work stream. Well, they've got a separate work stream where they're thinking about how to make federal resources inclusive and accessible, which is just going to be a really important enabler of all of this when you're giving navigators some of the tools that they need to get people connected. They've got a separate work stream that is focusing on funneling remaining funds directly to on-the-ground institutions to design their highly individualized, like the church knows exactly what its constituents are going to need, like things like that. They've just got a very good bird's eye view of where funds will be helpful at the top and where funds will need to go on the ground. So for the most part, I think states have been reading a lot of the digital equity and inclusion literature that's been out there, and I've just seen a lot of really hopeful things from a lot of the state plans I've read. There are also a handful of pre-existing programs that have been very briefly really great and that I think a lot of people can draw from. One that I'm sure has been mentioned today, or if it's not, I'm sure most people in this room have heard it, is Detroit, Michigan's Connect20 program. Again, impossible not to bring it up, but this is basically just a citywide digital inclusion initiative that's a public-private partnership, and it basically runs the gamut in terms of what you can do when it comes to advancing inclusion. They offer digital navigator programs, digital literacy courses, device refurbishment, and information dissemination about the ACP and similar programs, tech hubs, like Comcast's Lift Zones, just like community spaces where there is a place for a computer and internet access if you don't have it. And they're definitely doing something right because the last time I checked, they had the highest ACP take-up rate, like the Detroit metro area of any metro area in the US. So states are doing very well overall. I think as much as they can look to each other for what they're doing well, look to pre-existing programs, especially about half the digital equity plans are out so far. The remaining ones, as long as everybody just keeps stock of the current and evolving landscape, it really looks like there's a lot of good information, and there are good programs out there for states to look to.
That's awesome. I love the Detroit example. I got to be in Detroit. I spoke at their Digital Inclusion Week. I think it was earlier this year, and it was an incredibly interesting event. And I think so many of the folks that you mentioned were definitely present in that room and thinking about what does Connect 313 or 313 look like even going into the future. So a really great call out, I think.
Kate, the last panel was asked whether states should do this work or local communities. And I think everything that Jessica just shared was a really good example of how the answer is both and. right? That there is a clear...
Giving the political answer
right.
again, though.
No, I know, but it really is, especially when we think about data collection, right?
Yeah,
that I think
absolutely.
so. It's really tricky oftentimes for small local organizations to try and do that work on their own. So if in some of these examples, states are really kind of not only collecting data to figure out where the money needs to go, but making that data available to their partner organizations for them to use in outreach, I think that's a great model to be thinking about how states can continue to sort of like lift up and support the on-the-ground community-based organizations that are doing the work.
I mean, so I think both of you have done just a really great job laying the foundation of what's currently out there in the space, either in the digital equity plans or in the literature. And I'm curious if you could just take a couple moments to tell us, what have you noticed is missing? So, I mean, I know it's you know, there's a lot out there. There's, I think, a wealth of examples and some just really amazing work that's happening, much of it driven by the people in this room. But I'm just so curious, where are those obvious gaps that you're seeing that we should be working towards filling or bridging or having conversations about? Even if it's a really challenging conversation, I think it's good to call out where those gaps are. So I'm going to start with you, Michele, and then go to Jessica.
Yeah, I think that the reality is if you look at historic navigator data evaluation programs, or if you look to current day what we're talking about, I think that the problem is that the data is really sporadic.
Yes.
And it's not consistent. So while I heard lots of people talking about how amazing it is, right, that we have states that have the ability to deploy these programs to the way that makes sense for them, what that means oftentimes then is that you have huge gaps in your data because one state isn't collecting the same things that somebody else is. They're not talking to each other. And there's no sort of like clear prescriptive game plan of what we're going to measure, how we're going to measure it, and what that's going to look like. And so while you may have really good sort of shining examples at places, throughout the country or municipalities, it's hard to tell sometimes what the big story actually looks like. And so because what might work, for example, and have worked in Illinois, doesn't necessarily tell us anything about what might work in Arkansas or Louisiana. So I think that is one of the hardest parts of the story, is that while you do want to collect data and make sure that it is reflective of the work you're doing and informs the work that you're doing, it sometimes is kind of tricky if you're in a state that perhaps doesn't put the same kind of value on that. And so you might be operating in a little bit more of a blind kind of perspective than others.
No, these are all absolutely great points. The thing about digital inclusion is really that there's always an inherent tension, because on the ground, you don't want things to be too prescriptive, especially coming from the top. Like, every program needs to be very individualized, very based on the individual data of that community. But at the top, there is room for a certain amount of prescriptive, you need to collect this type of data, you need to send it here at this time. Like, certain things do need to be standardized so that all of these disparate programs can be brought together under one umbrella, and everybody can make sure that it's all working towards the same aim and the same standards. So I do think we're missing everything you said. We're also missing
We're missing everything you said.
overall approach,
Yeah.
I would say, and we're working towards it. And there are several different work streams where we're trying to work towards this, but just an overall approach where we understand that these are the highly specific things we will work for. This is what success with digital inclusion will look like. Specifically, this is how we will define the metrics. This is the type of data that you states have to collect. You have room to adjust it if necessary, and maybe there can be an interactive dialogue, because I'm sure states and localities will have input on what types of data are necessary, but at a certain point, things do have to become standardized. Data is the single thing that I would say we're missing the most, and I keep coming back to that. But the fact that we do have several strong data sets, I'm not saying that we don't. If you're thinking about digital inclusion and the fact that inclusion basically needs to address sources of the problem, at this point, people who are not online can't be reached by definition by the broad brush approaches that we've taken in the past, because they haven't worked yet. So today, successful inclusion approaches have to be very individualized and very based on the specific problems. But so to be able to address those problems, we need very strong data on what they are. And we have some very good national surveys on why people don't adopt. I'd say the most authoritative is NTIA's Internet Use Survey. A subset of what they measure is people who don't adopt home internet and why they don't. And this, is a national survey. It's regularly put out. It's very authoritative, and they put respondents into a few buckets, but one of those buckets essentially has respondents say that they're just not interested in the internet. And there are so many different things somebody could mean when they say they're not interested, and there are so many different interventions that could be necessary to reach these different subgroups under that larger group. So just doing some more work in spaces like this, trying to really clarify the very specific granular reasons that people aren't adopting, I think would be very helpful. Having a national data set on our digital literacy rates, because I just haven't seen one. That's another area where we were deeply, just some states, like the Hawaii example that I mentioned, are coming up with their own, but essentially we have no idea how the US is doing, at least with current data. There is an OECD data set that's 7 years old at this point. There are some things people are working off of, but we really need a national effort to collect strong digital literacy data and just get a better data-driven understanding of what the inclusion landscape looks like right now if we want this data-driven approach.
The only thing that I would add, and quickly, I know that at the beginning of this I said that states can be good partners collecting high-level data. I don't want you to take away that means that you should underestimate the power of the data that you have available to you, the people that are working as navigators and those community organizations. And by that I mean that we shouldn't necessarily discount the qualitative data, the stories that you are experiencing, both from the folks that have been helped by navigators and from the navigators themselves. And I think that when we're thinking about the advocacy side of this, if we're advocating for these policies to continue moving forward, oftentimes it's the videos that we've been popping in and out. It's the navigators that are coming up here and explaining their success stories that makes the difference. If I'm sitting across the table from a legislator, while they do want to know the national rates and the statistics, what tugs at their heartstrings and what can sometimes make the difference is the personal stories. And so I think it's really important that we think about that's everybody's job to play, and that we see that as data too that's just as valuable.
Go ahead. You can be our final comment before we take questions. So start thinking of questions while Jessica rounds us out.
That's an excellent point, and I just want to agree and add on to that. Many existing digital literacy or digital navigation organizations already are essentially collecting their own data. On NDIA's website, they put out examples of entry and exit interviews. Many of the organizations that I've spoken to conduct these types of interviews, essentially assessing where the person who's coming in is in terms of their digital skills knowledge, where the gaps are and what they're there for. And then in the exit interview, was your problem solved? Also, how was it solved? How long did it take? And this is the type of thing that can be really helpful in helping us figure out that maybe it's most important for somebody to be able to come back to the same person a few times, much more helpful than a single one-on-one interaction. Maybe generally longer interactions are better than shorter interactions. So continuing to collect that data, but then at the higher levels, finding a way to make sure everybody's collecting it and standardizing it, and somebody collecting it all from all of these disparate organizations and seeing if there are any patterns or trends. That's all, I think, a really helpful thing to think about. But it's a great point that some of the most valuable data is already out there and being collected, and it's just about using it.
Awesome. Thank you both so much. So I'd like to take a moment and see if we have anybody in the audience or online who has any questions before we wrap up for the day.
There's infinite data we can collect, but I'd love from your perspective, what is the top 5 pieces of data or insights you think are important?
Back to NTIA's Internet Use Survey, I would love one question that NTIA has added in the past is how much people would be willing to pay for an internet connection, for a subscription. And I would love if they took that more proactive approach and applied it to people who are not adopting for other reasons, and essentially said something that I think has been in another Comcast survey in the past: what would have to change for you to be willing to get online? Directly asking people what they want to be able to get online. That's something Connect20 actually does really well. They pull people continuously and they ask them what they want or what they need, what's stopping them from getting online, but what type of intervention they need, like an intervention, technical training, or access to a computer or an internet connection or any of that, just directly going straight to the people and asking them what they need to change for them to be able to get online, I think is the single thing that would make the most difference in this space?
I feel confident in saying Comcast has asked that question because I'm fairly
Yes.
confident I wrote it. So
Yes.
yeah, I'm clear with that. Okay, I think that's a really good point, and one, especially like thinking about that NTIA data is, we often talk about relevance. People are surprised
Yes.
that how many people who say that primary reason is something that I'm just not interested or I just don't want it. And then you have, devices is 3%, these
Yes.
much smaller pieces, but that I'm just not interested is so big. And I agree, having just a little bit more information can be incredibly interesting. What are your other anything in the top 5 data sets?
No, I mean, the only thing I would make a case for is just instead of on the sort of end user side, is collecting the data on the navigators themselves. So again, who they are, what the demographics look like, where are they working. I think it's super important to document this workforce and the work that's being done there.
So when we're talking navigators and like state, you mentioned the states creating the digital equity plans, for instance, and you mentioned the state of Maryland. I'm wondering your thoughts on the role potentially that digital navigators could or should have potentially played in collecting the data, the state collecting the data on the community level. And I ask because the state of Maryland, for instance, current draft of their digital equity plan, they talk about how they, did phone calls to 1,900 Marylanders out of 2-point-something million Marylanders, but they, called 1,900 Marylanders to get kind of what are your digital skills? What are you using it for? Can you navigate? And these 1,900 community members represent various levels of income, various zip codes, but specifically the low income threshold is for those making $50K or below, which we know is not representative of those who are disconnected necessarily. So what are your thoughts around state partnering with navigators on collecting that community voice and data to inform their digital equity plan or potentially plans in the future?
My initial thought is to ask the navigators to collect data because they're very comfortable in this space. They have the pre-existing relationships, but I would be wary of putting it all on them because navigation services aren't everywhere. And like you're mentioning, a lot of the subsets of the population that are less likely to be online probably don't have active navigation programs right now. So I think there should be some form of partnership. Navigation services everywhere should definitely have a role to play where they're available, but that, along with the state, but that brings up a broader point about when you're collecting the data, making sure that it's representative. There is the potential for an enormous issue there because, again, we keep seeing this pattern where the groups that are less likely to be online or, marginalized in other ways, less readily available or trusting for these data collection actions. So you really don't want to end up with data sets that are really just representative of the most accessible population. So that is just something for everybody to be conscious when they're coming up with this data. I do think in terms of what data to collect and how to collect it, there's the obvious, do not ask people why they're offline through an internet survey. Things like that.
I've encountered this before, sorry.
No, of course. So things like that, definitely be conscious of them. Because there is an issue of trust in a lot of offline communities, be thoughtful about what you ask. Don't ask for unnecessary information, don't ask for a social security number or something identifying that just really isn't necessary. Be very transparent about what you're asking for and exactly why you're asking for it and how it'll be used. And yeah, as much as possible, probably use, similar to navigation services, use trusted local individuals to collect this data where it's necessary. It would still probably have to be a top-down approach. And I would never say put it on one group. But yeah, absolutely keeping in mind that the data has to be as accurate as possible and really has to be representative, which is probably going to be the hardest part, is critical.
I would argue that you may want to think about broadening the partnership as well. So in Illinois, the model was that the state worked with both community organizations to do the navigation work, but then also brought in university partners to do the data collection and the analysis. We've heard from a few different university representatives today, and I think that either thinking about that at the state level, bringing in the universities, but also all of us have, close by universities, people that you may have partnerships with other things, and thinking about those really sort of eager, excited graduate students. I started my research on this as a doctoral student, and I was thrilled to be able to be entrusted and to learn my craft with this very rich, important new data set. Obviously, I had mentors that were working on it with me, but I do think that we shouldn't underestimate that and shouldn't burden, right, the navigators with trying to learn a whole nother skill set while they're also trying to do the really hard work of navigating. So if you have people that their job, what they've been trained to do is accurately write surveys, is to ensure samples are representative and to make sure that the way that it's analyzed isn't biased, why not let them do that work? Because I think what you'll find is that there are partners out there that are excited to get their hands on the data and could really help you then as you're thinking about going after that next grant. Maybe it's not going to be a state or a federal grant, but maybe it is having that story to tell to a private funder. And so as the professor on the stage, but representing universities in general as partners, I think thinking about data collection and not feeling like you have to be overwhelmed in doing it all yourself is probably an important kind of role that other kind of piece can play here.
Well, I think unfortunately that's all the time we have today. No one showed me a card in a minute, but I just feel like it. And so Jessica, Michele, thank you both for your time today. Thank you to the audience.